So we're going to talk about some of the hormones and peptides that can optimize performance. Of course, the first one up here is testosterone, which is the one that we most commonly think about. It's obviously for men and for women massively important for maximizing and optimizing performance. We think about the common things, right? Burning fat, building muscle, giving us that edge, that extra energy to perform our workouts. But it does a lot of other things as well. And it's a whole other realm in terms of the health benefits, which we know massively affect men and women in a positive way in terms of helping us to, quite frankly, live longer, prevent heart disease, decreasing the risk of osteoporosis, improving endothelial function, and so on, many other functions. But in terms of performance, obviously there's a mental effect as well, right? It helps with our motivation, our drive, our get up and go. That's what a lot of men who come to see me are complaining about. They just don't want to go to the gym. They just lost that luster, that drive to go. So helping in the mood and how we feel, it's going to make men feel better, which of course is going to translate into other areas of their lives, treating their spouses and their kids better, performing better at work, but and obviously performing better in the gym. So mood and a mental aspect, and of course definitely will help with lipolysis or burning fat, as well as anabolism, building that muscle and performance in the gym. DHEA is another supportive player, kind of a less well-known one, but it's a very simple thing to supplement. Most people are a little deficient in DHEA. Minimal side effects, if any at all, and very safe to take. It's going to be available as an over-the-counter supplement. We only use a couple different companies that work only with physicians' offices to ensure high quality. But DHEA, again, can help with muscle building, helps lowering inflammation, helps with bone, skin, decreasing risk of cardiovascular disease. It can improve insulin sensitivity, help with immune function, help lipolysis, fat burning, etc. And it more or less keeps those normal cellular processes humming along. Most of the time when we supplement with testosterone, I like to put off, if they, especially unless they're deficient, in supplement with DHEA, because it's that feedback loop. When patients are supplemented with testosterone, your body will make less of its DHEA. So I just like to keep those normal processes humming along and keep those levels optimized as much as possible. Growth hormone, of course, we want to keep that maximized as well. A host of benefits, which I talked about in other videos, but helps with obviously with anabolism and tissue growth, bolstering and improving immune function, helping with libido. Certainly can help with lipolysis or fat burning, lowering inflammation, improving insulin sensitivity, decreasing atherosclerosis, helps with overall healing of the body. Sometimes it gets a bad rep. It's certainly exogenous growth hormone stimulation, but we like to use the peptides to make your body make its own growth hormone and other functions in a more natural way. It matches the circadian rhythms of your body, so it produces growth hormone at the normal times, whereas growth hormone exogenously, it's more of an artificial elevation, which is why a lot of people, the effects wear off after a while. Some patients have told me it just doesn't work anymore. Well, that's why, because your body's used to it and it's adapted. And you have to go with the flow, so to speak, and do it with your normal rhythms, and get those normal pulses of growth hormone at the normal times. Your body will not adapt, especially if you're doing it appropriately and dosing it in a certain fashion. You can continue using it indefinitely. It's not to say that even peptides will stop having an effect after a period of time. That's possible. Most of the time, patients do well in months, even years, especially if you do it in a certain way or you rotate the peptides, yet still getting the same function. More advanced strategies we'll get into later. But with the peptides, most commonly with growth hormone, we'd use a combination. There are many out there. GHRPs and GHRHs, CJC apomorelin is the most common combination. Testosterone is another fantastic one, especially for fat burning and lipolysis. But again, all these can increase help with burning fat, improving lean body mass, decreasing inflammation, improving healing and repair. Massively important for mitochondrial function, which we'll talk about in another video. And this is where we get into things such as PGC1 alpha and AMPK. It's that balance between mTOR and AMPK, and the boosting of PGC1 alpha that improves and the overall improvement of mitochondrial function, making more mitochondria, which of course are your powerhouses of your cells, which are going to fuel your body and everything, but certainly in regards to performance as well, right? So, and we'll talk about in future videos how to balance that out, but by boosting mitochondrial function, because massively helps in performance. And again, this is with these peptides, these have receptors elsewhere in the body. It's not just about growth hormone, but these GHRH receptors we're finding that they have receptors in the body, all throughout the body, and have beneficial effects in and of themselves, above and beyond the stimulation of the growth hormone. So that's why it's doing a lot of things. I'm going to do a couple videos just specifically talking about these peptides and get a little bit more into the geeky science of it and explain that. Some of the more advanced ones, we talk about BPC and kisspeptin, MGF1,